Question 65, the kidneys. They are ovoid in shape and they are flattened on the front and on the back side. It has an anterior and posterior surface, a medial and lateral margin, and superior and inferior extremities, or ends. They are situated in the retroperitoneal space, lying at the level with the 12th thoracic to the 2nd lumbar vertebrae. The right one is slightly lower. And the posterior relations are the same for both kidneys. You have the diaphragm, green space, and you have psoas major muscle, quadratus lumborum muscle, and transverse abdominal muscle. And then you have 11th and 12th rib on the left kidney and the 12th rib on the right kidney. This is the posterior. And lastly, you also have iliohypogastric nerve and ilioinguinal nerve. Now the anterior relations of the right kidney. You have suprarenal gland, duodenum, right colic flexure, and the liver. This is the bare area of liver, so it would lie on top here. The left kidney anterior relations. You have suprarenal gland. You have the stomach. Here you have esophagus, so it would be here. The pancreas. The left colic flexure. The jejunum and the spleen. Now the margins of the kidney, you had a medial and a lateral margin. On the medial margin you have renal hilum, which contains renal vessels and renal pelvis. The renal hilus leads into the renal sinus, which is the kind of cavity inside the kidney. And it contains branches of the renal vessels, minor and major renal calyces, renal pelvis, and perirenal fat. The kidney is covered by perirenal fascia. See here it's cut. So perirenal fascia, and it is divided into anterior and posterior layer. And above and laterally these two layers are fused. And medially the two layers are continuous with areolar tissue surrounding abdominal aorta and inferior vena cava. And below the two layers remain separate, enclosing the ureters. Now the kidney is held in position by renal fascia and renal vessels, but mainly by a position of neighboring organs. The general structure of the kidney, you have the fibrous capsule on the surface, then you have the cortex and the medulla. The medulla is subdivided into pyramids. Each has a base and an apex, and the apex has a renal papilla that projects into the renal sinus. It's marked by small openings called papillary foramina. And the pyramid and the adjoining cortex form the renal lobe. Now the blood vessels, you have renal artery, in the renal vein that divides into the branches in the renal sinus. And the nerve supply of the kidneys are by the abdominal plexus. Here it goes to the kidney. These are sympathetic fibers. We have parasympathetic fibers from the vagus nerve.